Today I am going to speak about sports injuries. Why sports injuries are common and why to address that. Nowadays, as you are aware, a lot of youngsters and middle-aged people are into active sports. Because of active sports, there are some sports related injuries also. In that, especially when it comes to the knee joint, ACL and meniscus tears are most common sports injuries. So what is ACL? ACL is a ligament which attaches the thigh bone and to the leg bone, which maintains our structural stability. Whenever there is a twisting kind of a force, while you are playing a badminton, football or a volleyball, when you land and suddenly the leg gets twisted like that, the ACL gets torn. When the ACL gets torn, usually gives you a sense of imbalance. The patient will usually come and say, "Sir, I am walking, suddenly I feel there is a loss of balance, I trip and then I fall." It is also called as buckling effect. That kind of a sign is a classical sign of an ACL tear. Whenever there is a ACL tear, especially in young and middle-aged people, ACL will not have the capacity to heal on its own. It needs to be operated and it has to be reconstructed using some grafts. Usually it is done in a keyhole surgery. Nowadays, with advanced in technology, we don't do a open surgery for ACL and sports injuries. Majority of the sports injuries are managed with keyhole surgeries. The benefit is small scar, less stay in the hospital, quick recovery, and usually a daycare procedure, and most of the time it is painless surgeries. Patient usually can be discharged on the same evening or maximum by next day. The next is meniscus. What is this meniscus? There are two meniscus in the knee joint called as medial and lateral meniscus. They are like a shock absorbers. When we jump, run, our thigh bone and leg bone does not come in direct contact with each other. The meniscus will create a sense of cushion and avoid friction. So that meniscus is a rubber kind of a tissue. When there is a sports injury, there can be a tear. There are different types of tears of meniscus. Each tear is unique in its own way. That meniscus is very, very important structure. This kind of cartilage damage happens when the meniscus is not repaired quickly. It leads to arthritis, and arthritis is usually an irreversible thing. Before the cartilage damage happens, meniscus needs to be repaired, and now with so many technologies, it is a very, very simple and easy to repair the meniscus through a keyhole surgery. Most of the time we do this surgery in the morning and patient goes home in the evening without much problem, and in 3 weeks they can resume most of their normal activity, and in 6 months time they can go and play competitive sports also.